Hi, this is John Fallett with Senior Enrollment Solutions. Today we're going to be discussing the top 10 questions on Medicare. Question number 1. How do I enroll into Medicare? Well, generally speaking, for those of you turning 65, you should automatically receive your red, white, and blue Medicare card with your Part A on it. Your Part B is a separate question. Whether or not you're drawing Social Security will determine whether or not that Part B will automatically be sent to you. Otherwise, you will need to go to the ssa.gov, the Social Security Administration website, to enroll into Medicare or to let the government know, regardless of this payment from Social Security, that I'm ready to take on my Medicare Part B. When do I sign up for Medicare? Well, great question. Typically speaking, that Medicare sign up should be done between 3 and 5 months prior to your 65th birth month. You are able to enroll into Medicare supplemental plans to lock your rates in for those 6 months until you're eligible for Medicare, as well as the first 12 months thereafter. So technically, you could lock your rates in up to 18 months, but realistically, for you to have your cards, your paperwork, your billing, all set up in an order for the government to know who to bill any medical claims, prescription drugs, you should be having this done 3 to 4 months ahead of time. How much does Medicare cost? For most consumers who've worked 10 years as a U.S. citizen, your Part A of Medicare has no cost, your hospitalization coverage. Your Part B of Medicare currently has a premium of $135.50 in 2019, going to $143 in 2020. The difference between a Medicare supplement and a Medicare Advantage plan. I get asked this question all the time. There's only 2 different ways of covering what Medicare is unwilling to cover for you when it pertains to your deductibles and that 80/20 coinsurance. Your first option is to purchase a Medicare supplemental plan. The pros of a Medicare supplemental plan, or the positives, are you would have 100% or darn near 100% coverage for anything medically related. So excluding dental, vision, hearing, and prescriptions, everything medically necessary would be covered at or near 100%. You would be able to go to any doctor, any facility, nationwide with no referral requirements. As long as they accept that red, white, and blue Medicare card of yours, you can go anywhere you wish to go. Now the downfall. There is no prescription drugs attached. That would be a separate entity. You would have Medicare Supplement Plan A with prescription drug carrier B. Secondly, there is a premium involved. You're prepaying to have this level of coverage, this set it and forget it style of insurance, that you're paying this provider $140 or $150 a month to know that you can go anywhere you wish without any referral requirements and be covered at or near 100%. Now, your other option to fill in what Medicare is unable to fill in for you is to purchase a Medicare Advantage plan. Now, the positives of a Medicare Advantage plan is that there's many, typically in your area, that have no monthly premium or a very low monthly cost. With a Medicare Advantage plan, they do front load these policies, providing you dental, vision, hearing, transportation, gym memberships, over-the-counter medications, and a slew of other benefits that no supplemental plan nor Medicare is willing to provide to you. With a Medicare Advantage plan, your prescription drugs are built into that plan. It's an all-in-one plan. Now keep in mind, it's important to not only focus on just the monthly premium, but also to add up your copayments on this Medicare Advantage plan so you can see what your total cost is as opposed to focusing on some fictitious monthly premium. Now, with any Medicare Advantage plan, you'll find that they're all just like health insurance. They're all PPOs or HMOs. They all have copayments, they all have deductibles, and they all have a risk set by the federal government not to exceed $6,700 in out-of-pocket risk. It's why most of you, 9 out of 10 of you, choose a Medicare supplemental plan. However, with a Medicare Advantage plan, there are 2 additional caveats that you have to be aware of. First, you can try out a Medicare Advantage plan for up to 1 year's time, and you can leave that Medicare Advantage plan and return back to original Medicare and purchase a supplemental plan with no health questions asked. If you're on a Medicare Advantage plan longer than a year's time, you would have to be underwritten or prove your health risk to be able to return back to original Medicare and purchase a supplemental plan. Oftentimes, this is where consumers are penny wise and pound foolish. Secondly, No Medicare Advantage plan covers your Part B excess charges. If you wanted to go to the best cancer facility in Minnesota, first, that facility is probably out of the network. That HMO or PPO is not a participating provider of that facility. Secondly, they're going to charge you more per room and board day charge, more per therapy, more per testings than what Medicare deems a reasonable charge. You would be responsible for a portion of this excess charge that this facility is charging above and beyond what Medicare deems reasonable. They're going to get you coming. They're going to get you going. With a Medicare supplemental plan, they get you coming. You know exactly how your coverage is, what your responsibilities are, and what your monthly premiums are. Where with a Medicare Advantage plan, they get you going. There may not be a monthly premium. You get the luxuries of Medicare. However, you don't really utilize or pay for that insurance until you actually use the insurance. So, very, very different animals. How can you compare prescription drug plans? Through the Medicare website. Do not go to a carrier's site trying to add up your copayments, deductibles, and out-of-pocket costs. It's all at the Medicare.gov site. If you need instructions, I'd be happy to send you instructions. We'd be happy to go through your medications with you to make sure that you're on the plan that you best deserve as well. But you should be adding up all three components, premium, deductible, and copayments, through Medicare's website, and Medicare will determine and add all of your copayments up for you or with you to determine the least expensive annual costing plan. Which is the best Medigap company? Generally the one with the least expensive premiums with the highest rated insurance carrier. Understand, if one carrier was able to dominate the entire United States, it would be classified as a monopoly, and no one would like that. So many insurance carriers have regions or pockets where they provide lower premiums for females, they provide lower premiums for smokers, they provide lower premiums for those that are older, different zip codes, different counties. There is no one best Medicare supplemental plan. The coverage is identical. It's standardized across the nation. So as long as you're shopping a Plan G is a Plan G is a Plan G, it doesn't matter the provider that you choose, that coverage will be identical. So what you're after as a consumer is the least expensive premium with the highest rated insurance provider. You can shop all of the premiums at seniorenrollmentsolutions.com. How does a Medicare supplemental plan work? Well, with a Medicare supplement or a Medigap policy, it's in essence your secondary coverage. Your doctors, your physicians, your specialists, your facilities would bill Medicare as a primary insurance provider. Medicare would pay their portion and bill your secondary insurance provider. Now, depending on the level of coverage you chose on that supplemental plan will determine the amount that you're responsible for. Most supplemental plans will cover you at or near 100% of what Medicare doesn't cover for anything medically necessary. Excluding dental, vision, hearing, and prescriptions, most supplemental plans will cover what you're missing pertaining to your per occurrence deductible, as well as your annual deductible and that 80%, 20% coinsurance rate that Medicare has. Where can you use your Medicare supplemental plan? Well, Medicare supplemental plans are accepted by any facility, any specialist, any primary care, as long as they accept your original Medicare red, white, and blue card. You can use any carrier at any facility. There are no network restrictions or network requirements. When can you change your supplemental or your Medigap policy? On a monthly basis. As long as you make a premium payment to that private insurance carrier, they will never drop your coverage. However, they will continue to increase your premium. So understand, if you enroll into a Medicare supplemental plan with a date of birth October 1st, your anniversary would come October 1st and you would receive a rate increase letter for the following year. You're not bound to staying with that supplemental plan. You can reshop your coverage on a month-to-month basis if you so choose. You're not bound on an annual basis like you are with your prescription drug coverage. Does Medicare cover dental or vision? Great question. Dental, typically not. Unless you have additional coverage through Medicaid, unless you have a Medicare Advantage plan, dental would generally be a separate entity. You're more than welcome to visit the dental tab on the Senior Enrollment Solutions website for either a traditional plan or a fee for schedule. There's only two different styles of dental insurance, either a traditional plan or a fee-for-schedule plan. Once you understand those two differences, then purchasing your dental insurance is very easy. When it comes to vision, if you have a disease of the eye, glaucoma, cataracts, or you're a diabetic, then yes, Medicare will assist in covering your eye examinations and covering your glasses after having cataract surgery. Typically speaking, for most, there is no vision coverage. Generally, you'd want to have your eyes examined either by an optometrist or an ophthalmologist. You would receive a Medicare discount. There are a few carriers that do offer a vision discount plan embedded in their supplemental coverage. If you have any questions, certainly reach out. However, typically with vision, that would be a separate entity. I would ask of you to go have your eyes examined, get the measurements of that examination, and purchase your eyewear online. There's a slew of locations where you can purchase your eyewear for less than $100. Bifocals, graduated, scratch-resistant, ultraviolet coating, etc., and not pay full retail cost for your eyewear. Understand that we're here to answer all of your questions. If you need any additional assistance, www.seniorenrollmentsolutions.com for all things Medicare, or phone us at 877-777-5972.